Good morning. My name is Falakia Dunty, and I'm your assigned nurse for today. How are you today? We are here today to discuss about your skin cancer and go over all the purpose and goals of the surgery. So I will give you a brief definition of exactly what skin cancer is if you already don't know. Skin cancer happens when there's an abnormal growth of skin cells that is often developed through being exposed to ultraviolet lights, for example, sunlight. The goal is to remove the infected skin through a surgery called Mohs surgery that will allow your cells to return back to normal, and in other words, back to homeostasis. Now I'm going to give you a lot of information here, so please bear with me. The purpose of this surgery is to remove all of the harmful cells while at the same time saving all of your healthy cells. Looking at your chart here, you were diagnosed with basal cell carcinoma, which is a very common type of skin cancer that most people get. Let's start with the word basal cells, which describes to us the location of the cancer, which is on the outer layer of the skin, which is also known as the epidermis. Now, carcinoma can be broken into two parts: carcin, which stands for cancer, and oma, which stands for tumor. The person that will be performing your surgery later today will be a medical doctor, but more specifically, a Mohs surgeon. And then after that, we will have a plastic surgeon come in and finish up the remaining of the procedure by closing you up with stitches to allow minimal scarring. So starting the procedure, after they examine the affected area, you will be given anesthetics by our fellow anesthesiologists that will be in the room, which will allow you to not feel any kind of pain during the entire surgery. Mohs surgery is completed through various stages, so our surgeon will remove cancerous tissue layer by layer. While performing that, he will also be looking through a microscope to map out the cancer correctly until all of the cancerous cells are removed. The procedure can last anywhere between 4 hours or less, and sometimes it can be longer depending on the severity of your cancer cells. The only risk, or the one risk that you may face afterwards, is scarring, but with the technique used during the surgery, it allows for low scarring to occur. On the bright side, this type of cancer has a low rate of returning once it is removed completely and effectively. Once the surgery is completed, I recommend that you keep the bandage on for about 24 to 48 hours, and also keep the wound clean daily once you do remove the bandage off. Also, be safe around UV lighting, so try to wear sunscreen, sunglasses, or just wear extra covering when you are outside to avoid infections, which can be caused by exposure of UV radiation and also lead to mutation and weakness of the skin. I recommend you come back to us for a follow-up within 7 to 10 days for us to remove those stitches we placed. If you have any more questions or concern, please do not hesitate to ask. The Mohs surgeon will be in here shortly to answer any other questions that you may have. I wish you the best of luck, and I will see you in post-op after your surgery. Have a great day.